Okay guys, so for this skill we're going to be doing nail care. 9 out of 10 times if you get nail care on your state test as a skill, you will be, if you'll just show them on the camera, that little guy in the wheelchair with the table, if you'll just turn it around, 9 out of 10 times you're going to be right there at that setup, okay? So you won't even have to fool with the bed rails and raising the bed and all of that stuff, okay? But there's a chance that, you know, if it's a popular skill that day, you will be on a bed, so that's how we're going to practice. So what are my first 5 steps? Knock, identify, explain, privacy, and hand hygiene.
Would you knock with that little guy on the chair?
Yes, because he's still, because we're still pretending he's in his room, so we'd still do the first 5. And then this one, they're going to be completely sitting up in bed when we do this. They wouldn't need to be, really they could be lying down, but for us to put the table, just for positioning to look better, we're going to sit them in a Fowler's position. Okay, so I'm going to lower my rail, and then I'm actually going to take my table and put it across my patient, so that they can have their hands here. Okay, so for this one, we're going to use a paper towel. Every bed will have a paper towel dispenser. So I'm just going to get a paper towel, and I'm going to place this underneath the kidney basin. I can go ahead and put my gloves on. This kidney basin is going to be 2/3 full of warm water, so we're going to verbalize that to our evaluator. And then I'm just going to, the best I can, take my patient's hands and let them soak in that kidney basin. Just put his hands here. And I want his hands to soak for 10 minutes. Okay, so I'm just gonna verbalize that for 10 minutes. I've soaked my patient's hands, his fingers. Once I've done that, then I'm going to take my orange stick, the same thing that we use to clean under our nails when we're doing hand hygiene. And with one hand still in here, I'm gonna take the other one out, and I'm gonna clean underneath all of my patient's fingernails. And I'm kind of cleaning, dipping, and then same thing with the next hand. I'm going to clean and dip for each finger. So once I've done that, now I'm done with this kidney basin, so I'm going to move that out of the way. And I've got a washcloth here I'm going to use and just dry my patient's hands. After that, I'm going to take my nail clippers and I'm going to clip each fingernail. And I'm going to verbalize to my evaluator that I am clipping their fingernails straight across. So I'll do each fingernail. And then my last step will be to file them, and when I'm filing them, I'm just going to let my evaluator know that I'm filing them in a rounded shape so that there's no rough edges, so that they're not able to scratch themselves or anything like that. Once I've done that, then I'm completely done with their nail care, so now I can remove my gloves and discard those. And I can take this table away from them and go ahead and raise their rail and lower them back in. So again, most likely you will be on the wheelchair, and then in that case you're still doing your last 5 steps, the last 3 steps. Everything is the same except for this positioning. You won't have to fool with the bed rails and all that stuff. Okay. So I'm going to lower these side rails, make sure my patient looks nice and comfortable in their bed. And then my last 3 steps will be call light, hand hygiene, and report and record.